Good evening, everyone, and thank you for this opportunity to speak on one of my favorite topics in research, the case report. I thank the JCOT and the IGO team for organizing this extremely important virtual event for research, especially for budding researchers. So let's go on with my topic. I'm the founding editor for JOCR, which is publishing since 2010. So I do have some experience in looking at trends in case reports, how they have grown, how they have evolved, not only the reporting part, but also how the authors have written those cases, how the readers have perceived those things. So I'm going to share a lot of my insights rather than making it into a very technical lecture. Like everything, I always begin with reviewing what is the history of that particular topic or particular subject. When we go through the history of case reports, what is most important to note that most of our medicine is evolved through careful observations. So there were men that have noted what generally answered best for their patients and deployed that in their clinical practice. That is what a case report is, or that is what an observational study is. So careful observation, clear recorded description, and deductive reasoning that will promote and add to the existing literature and to clinical practice. So that is what the aim of a case report is. That's the basis of all case reports and basis of all medical literature. Now, as far as case reports are concerned, I refer to this very, very interesting story, which almost all of us are aware of, the tortoise and the hare. It's a very good surrogate for a case report where you have clear, precise writing. It is easily recalled whenever needed. It has a strong practical message. So slow and steady wins the race. So it's a very simply put up story which connects to its reader very effectively. Even it connects to children. So that's how the case report should be. Of course, there are technical things. There are a lot of references in scientific writing. But essentially, when the reader should finish reading your case report, he should remember it in a very short format, which he can recall easily, very similar to something like this particular story. So as an author also, you need to tell your story properly. Getting started to write a case report, how do you start? What first question that comes to the mind is what qualifies as a case report? Are only rare cases accepted as case reports? So in 2014, I wrote an editorial on busting this myth, and I actually wrote down all the ideas that could qualify as a case report. But the most important thing is any case that has a clinically valid learning point, it qualifies as a case report. So that is that for me as an editor of JOCR is a case report. It has a good clinical learning point with context to existing literature. So the reader will get something out of the report. That is what qualifies as a case report. So this is the essential question, whether the publication of this case will enhance the knowledge of reader and help them to provide better treatment for their patient. Anything you want to write, even if it is a case report or a randomized trial, ask this essential question. If the answer is yes, that research is a valid research and you should go ahead with doing it. So this is the essential question for all research projects, including case reports. So this is my key learning point 1. So clinical relevance has to be established beforehand before you start writing the report. What qualifies? Very rare diseases, association of diseases, uncommon presentation of common diseases, cases which contradict current knowledge, a new disease entity. Now, these are all established as case report criteria in most of the case reports journals. But most importantly, for us in orthopedic surgery, improvisation So decision making changes intraoperatively if there is an event occurring and you have managed it. Rehabilitation, there is something different that you have done. Complications specifically. So these are also things that qualify for us as orthopedic surgeons. I put it as DIC, deviation, innovations, and complications. These are all case reports that you can publish. And if any of your cases have this, it can be easily published. As an editor, I get this question very often. I got this great case. Is this publishable? People meet me at conferences or in hallways and ask me this question. It's very difficult to answer this question. The only way to answer this question is literature review. There is no other way to give a valid and precise answer to this. And results possibly compare and contrast with the literature. So this is very important, which we follow most of the time in GOCR. We ask them to put the review of literature in a table format. Photos of clinical science, surgical pictures, diagnostic studies are very, very important in getting your case report published. If you're missing these things, you might get a rejection even if the case report is good. In discussion, you have to focus on the main learning point. Like I said, in the first step, you have to ask the question whether this case report will add some clinical relevance to the literature. Discussion is just bringing out that clinical relevance in context with existing cases in literature. Synthesize your experience with evidence. Now, case report not only is evidence-based, but a lot of it is also experience-based. So it is a very good synthesis where you can put up your experience as well as evidence in context and present your discussion to the reader. Do not write a book chapter. Again, this is a common mistake which a lot of young writers do. Like introduction, in discussion also, they start discussing the topic. No, the discussion is only on your main result. It's not at all on your topic. So keep that in mind. References always include most recent references, or at least the most recent 10 references if they are available. Incomplete literature review is one of the most common cause of rejection. Now, why do I say this? Is not because your references are incomplete, because incomplete literature review brings out loopholes in your introduction where you have established that this case is worthy of publication. Literature review is very important to establish that fact, and that is the fact that will get your case report published. So in literature review, you have to do in depth and you have to spend a lot of time in reviewing the literature. Key point 3 is follow the journal guidelines. So I have detailed the structure of a case report in my earlier slides, but you have to follow the journal guidelines that are specific to each and every journal. So they want you to format in a particular format. You need to follow that. Otherwise, again, you'll get revisions and rejections. What next after you've finished writing the case report? Always get help, get second opinion or third opinion. Get advice early, especially regarding the key message and reason for the case report in terms of why it should be published. Get others, your colleagues, your peers, or your research group, get involved in this particular case report. Just give them the draft to read and ask their comments and opinions on how, if they have any suggestions for it. My best advice to do this is have a literature peer review also. So go through the last 10 case reports which are related to that particular topic. Read them, think about why they were reported and how did the author get the message across. So how did the author get the clinical message across is very, very important and a subtle art. So writing a paper or writing a case report is not only science, it's kind of art also. And once you read these papers with that angle, you'll start understanding that how the authors or the artists have put up their message across in certain sentences, in certain words, with help of literature. So you try and learn that art also. It's not only just technicalities or scientific structure. It's also an art how to put it. So to learn that art, you have to read and revise your case report as much as possible. So that's the key advice. 4. Ethics in publishing a case report. As for other kinds of research, consent is very important. Consider the privacy laws of your nation or your local body. You have to maintain the confidentiality of the patient. Even if the patient has died, you have to take consent from next of kin also. I will personally suggest that you can deliver the copy of published paper to the patient or the relative. They always feel happy when they get something, when they get to know that they have added to advancement of science. So that's a very good point. Common pitfalls: using sensational language, writing as a theory short note. This is very commonly seen. Unnecessary trying to establish rarity of the disease. So it is this percentage to this percentage, and then from that you again derive another percentage and try to establish the rarity. That's not important. Rarity of the disease is not really much importance. It's how clinically relevant it is and what the reader will get out of it. Not reading enough is a crime in writing any kind of paper. So if you are read enough, you'll be easily able to write a case report. In summary, my key points are: you have to establish the clinical relevance, thorough literature review, follow the journal guidelines, read and revise. Every case is a potential report, either as a case report or a part of a case series. So every case that you see, do, or operate is a part. Case report may be the beginning of a glorious and successful academic career. Even I began with a case report and then climbed the ladder. Tell your best story. Remember the story again. It has to be simple, easily recalled, has to have a good moral, good inference to carry, good clinical inference. Tell your best story. Best of luck from my side. Thank you very much for this opportunity again.